The gastrostomy tube is secured with internal and external bolsters. All PEJ tubes are removed by a physician either endoscopically or externally by applying traction. The gastrostomy tube is inserted through a very small opening, so it is a less invasive method than other surgical techniques. There tends to be less scarring and a quicker recovery time. 2. Surgical gastrojejunostomy tube. Gastrojejunostomy tubes may be placed surgically in the stomach and small bowel as single-unit tubes. This surgery is performed in a hospital operating room with the individual under anesthesia. The surgical gastrojejunostomy tube has a port for direct feeding into the small bowel, and a separate port for access simultaneously to the stomach for suction and medication administration. 3. Replacement jejunostomy tube. If a jejunostomy tube is pulled out, the physician will replace the tube. Types of feeding tubes, gastrostomy tubes. These tubes are commonly referred to as G-tubes and are placed into the stomach through an opening small hole in the abdominal wall. The word gastrostomy comes from two Latin root words for stomach, gastro, and new opening, stomy. A G-tube is used to vent the stomach for air or drainage and/or to provide an alternate way for feeding, hydration, and medication administration. Food, liquids, and medications infused directly into the stomach. G-tubes are commonly used in patients who need long-term feeding and hydration and are unable to take in adequate food or liquids by mouth. G-tubes may be used in conjunction with jejunostomy tubes. Some special tubes will actually be two tubes in one with openings in the stomach and the small bowel, jejunum. There are 4 kinds of gastrostomy tubes: PEG tube, surgical gastrostomy tube, replacement balloon gastrostomy tube, and feeding buttons. These tubes are usually made from a special material so they are not damaged by digestive acids. 1. Percutaneous endoscopic gastrostomy, PEG tube. PEG tubes are a gastrostomy tube placed using endoscopic techniques, using a thin flexible tube that can be looked through or seen on a TV monitor. These tubes are secured with internal and external bolsters. All PEG tubes are removed by a physician either endoscopically or externally by applying traction. The gastrostomy tube is inserted through a very small opening, so it is a less invasive method than other surgical techniques, and there tends to be less scarring and quicker recovery time. 2. Surgical gastrostomy tube. Gastrostomy tubes may be inserted by a surgical procedure performed in a hospital operating room with the individual under anesthesia. Surgical gastrostomy tubes are placed by surgical incision through the abdominal wall and then directly viewing and making an incision in the stomach. The gastrostomy tube is inserted directly into the stomach through the skin and abdominal wall overlying the stomach. The gastrostomy tube is held in place on the outside, bolster or catheter retainer, and on the inside, flange design bolster or a balloon inflated with water. Types of gastrostomy, G-tubes, continued. G-tubes, J-tubes, and gastrostomy buttons are usually covered by clothing, so individuals should be able to participate in activities. Participation in strenuous physical activity should be determined on an individual basis, with input by the physician to the interdisciplinary team. 3. Replacement balloon gastrostomy tube. Replacement balloon gastrostomy tubes are used after an initial gastrostomy tube has created a well-formed gastrostomy tract, usually after about 1 month. The tube is secured internally by a balloon inflated with water. A sliding disc stabilizes the tube outside the body. There is a separate port for inflating and deflating the balloon. If a gastrostomy tube is pulled out, the tube tract begins to close within 2 hours unless a new gastrostomy tube is inserted into the gastrostomy tract. Replacement tubes are inserted by the appropriate healthcare professional or trained caregiver. If the delegating licensed nurse determines it is appropriate, replacement of a gastrostomy tube is a potentially delegable nursing task. 4. Feeding buttons. The gastrostomy feeding button is a T-shaped plastic device held in place by a mushroom-shaped dome inside the stomach. The button remains in place at all times and is capped by an attached safety plug between feedings. My Key button. A feeding is administered by inserting a small tube through the button into the stomach. When the feeding is completed, the tube is removed and the safety plug closed. Low-profile devices buttons are a newer design inserted flush to the skin. These are more convenient and cosmetically pleasing for active consumers with well-formed gastrostomy tracts.